Assalamualaikum everyone. Hope you all are doing well. So today our workshop topic is sustainable development goals, and as we all know that the United Nations has assigned 17 major goals, and today we will discuss the goal number 3 is the goal good health and well. So let's start the presentation on today's workshop as well. So before moving forward to the goal of United Nations, I would like to mention one thing that this goal major covers about like there would be good health and well-being facility for every individual of every age. So the United Nations is working on this goal, and we should also move forward for working on this goal, which is good health facilities and well-being. So, in order to achieve good health and well being, we should focus on some key points or key elements, I must say. Okay, so let's discuss that why it is important to achieve like good health and well being in a society. So, if we have a good health and a good mental health of every individual, so our society will grow and they will generate more ideas, they will consider as a good society. If we work on every individual's mental health, physical health, as well as providing them good opportunities of environment like safe environment, the government should also work on the environment safety rules, and we should also consider to provide like good air quality as well to the people, because according to United Nations 23% of people are suffering from asthma. So we should consider that good health and well-being doesn't include like we provide only the health facilities, but also we should consider the environment as well and provide the good environment to every individual. So moving forward, like why we have to choose it, we should choose good health and well-being facilities to achieve some goals. Like if we are working on the health first, because health is wealth, as we all know that. So other things will be like in a good shape, as there is a connection of health, our goal of health with other goals provided by United Nations. Like if we are having a good health, so we would achieve the zero hunger and no poverty. Then after that, if we are having a good health, our mental health is in good condition, so we should focus on like attaining good education, and we would hard work in that as well. So the measure is like we have to focus on working of our health, not only just physical health but also mental health, because both of these are very much important. So we should consider according to goal number 3 of United Nations. Now the rest of the slides will be explained by Bisma. So moving forward to Bisma.
Hello, I am Bisma, second year public health student. So I will start from let's now talk about the global progress we made under SDG-3 and challenges we still face. Globally, we made a great progress in fighting infection disease and expanding access to vaccines, along with the significant reductions in child and maternal mortality. However, we face rising challenges. Non communicable diseases like heart disease are increasing due to unhealthy lifestyles, and unequal healthcare access remains a major issue in low income regions. The COVID 19 has also reserved some of the hard earned health and gains. Now, moving towards the global efforts to SDG 3, the global goals are attainable if we work together. So, for the global efforts to achieve SDG 3 involve partnerships like WHO coordinating health campaigns, UNICEF in improving child survival, and Global Fund in combating HIV, TB, and malaria. Now moving towards the initiative solutions like telemedicine improve access to care in remote areas, while public health partnerships and global financing help provide affordable medication and invest in maternal and child health. So let's work together. Everyone has a role to play in building a healthier, more sustainable future. Let's come together to make the goals a reality, because when we collaborate, we can achieve extraordinary things. So, what is your duty? What is your responsibility? Being a citizen, being a human, what you can do for SDG 3? So, for maintaining your good health and well being, these 7 practices are essential for maintaining good health: regular medical checkups, a balanced diet, mental well being, and avoiding harmful substances are just a few steps we can all take to improve our health. By adopting these habits, not only do we take care of ourselves, but we also contribute to the broader goals of SDG 3. These steps you can adopt in your life and make your life good and this slide emphasizes how we take change of our life well-being involves multiple dimensions, like as you can see, enhance health hygiene in practicing good hygiene to stay healthy, connect with other and by building strong relation for emotional support. It's being human being, it's important to build our emotional support. We need emotional support, so for that, build a strong relationship. Nourish yourself. How can we nourish ourselves? By eating nutritious food and fuel our body and mind. Support our mental health. Mental health is also a main part of our health, good health. So if you are physically healthy, you need to be mentally also healthy. So do work for your mental health too, by prioritize mental well-being through mindfulness and support. Move your body. How? By stay active to maintain energy and health. By working, do work and move your body. Get good sleep. Rest well to give rest to your body and mind. Protect your lungs. Avoid harmful substances for healthy breathing, like avoid smoking, alcohol. Consume responsibility. Make mindful choices about what you consume. Now moving towards the next slide. This slides I In this slide we can see the examples of successful community health and well-being. These are the programs which are running in our community and get successful. Some of them are community gardens, walking and biking trails, mental health programs, health and food access program, community fitness programs. So these programs are playing their role for community well-being of community and good health. So being a community member, being a citizen of one city, one state, it's our responsibility to work for our health as well as our community. So be participate in such type of community programs to serve your community. Thank you so much for all participants who attended this session, and thankful, and hopefully do you learn something and you will implement in your society too.